Good morning. I'm Dr. Frank Cerny, Professor Emeritus in the Department of Pediatrics, School of Medicine at the University at Buffalo, and Emeritus Professor in the School of Public Health and Health Professions at the University at Buffalo. My career started as an exercise physiologist specializing in pediatric diseases at Children's Hospital in Buffalo. I eventually moved to the University at Buffalo and became chair of the Department of Physical Therapy, Exercise, and Nutrition Sciences. I retired from that academic career and research career and took up the task of looking at the factors that were affecting our rural populations as it regards to the intersection of poverty and health. I think the topic of rural health is critical as we discuss public health, particularly during this month where we focus on it. Uh, Rural health has been ignored for too many years. There's been very little public or private investment in our rural communities. That's resulted in a loss of hospital care, primary care, and for certainly specialty care in rural areas. In my current role as the executive director of the Rural Outreach Center, we've recognized the intersection between poverty and public health and health in general, such that the what we are now calling the social determinants of health are the same as the antecedents and consequences of poverty. So at the Rural Outreach Center, uh, by addressing one, let's say poverty issues related to transportation and cash reserves and housing and so on, we're ultimately addressing the public health issues. We've come up with a mechanism to address multiple issues that these rural residents are facing and come up with a model where we put all of these things together into one package so that we're not addressing silos, but we're addressing these issues in conjunction with one another very effectively. We are changing the situation of families and children in particular to try to break the cycle of rural poverty. So this lack of investment in our rural areas has resulted in a decreased availability of health care resources. And because of the rural nature of our population, accessibility is an issue. Transportation. There's no public transportation in our rural areas. And for instance, in the area we serve, which includes about 4,600, 45,000 people in poverty, 8,500 of those people have no access to transportation. So transportation is a huge issue that we have addressed fairly effectively. What most people don't know about rural health is that the incidence, not the absolute numbers, but the incidence of most issues related to public health is higher in rural areas. The incidence of domestic violence is higher than in metropolitan areas. The incidence of chronic diseases is higher in rural areas, and that includes chronic lung disease, diabetes, and so on. The incidence of teenage pregnancy is higher in rural areas than metropolitan areas. All of these things come together to reach a point where the health needs in our rural areas are tremendous, but they're being inadequately addressed, leading to a large health disparity between health outcomes in rural residents and residents of metropolitan areas. So if we look at the most common disease entities that we see in our rural areas, cancer, COPD, heart disease, and so on. A lot of this can be attributed certainly to a lack of care, but the um, the genesis of these disease entities comes from the fact that many of these rural areas are where they site landfills, and there's toxic um, runoff from those landfills. There's a large use of pesticides, herbicides, and fertilizers that pollutes both the air and the groundwater. These folks deal with wells with no fluoridation, so dental disease is a big issue. So we need to begin to pay attention to this population and those things that contribute to these health disparities. So what could you do? What could we do together? Number one, you can advocate for rural populations. There have been few people advocating for addressing these rural health disparities. In your professional involvement, you can um, ask for a seat at the table for people representing rural areas so that their voices are heard and their concerns can be shared. Um, you can try to be a seat at the table and a voice for rural areas when health policy, and so on, health policies are being made so that these voices are heard and the more unique solutions to address these issues can be formulated. Thank you.